What happens when the potential harms of a medical experiment are not conveyed to its subjects? Is there a social moral responsibility to provide healthcare to all? And what does it mean to die with dignity? What are the conflicting social values and personal beliefs around such a practice? My name is Melissa Karen. I'm the director of the Mudd Center for Ethics at Washington and Lee University, and these are some of the questions we will think through together during our year-long program entitled How We Live and Die: Stories, Values, and Communities. The program, full of lectures, a panel discussion, and a multimedia art exhibition, effectively combines the scope and depth of both the humanities and sciences to address the most pressing issues of medical ethics today. So what is this field of medical ethics? There are four main pillars of medical ethics, and these are generally autonomy, giving the patient agency and information to choose freely; beneficence, doing good; non-maleficence, committing to non-harm; and justice, ensuring equity and fairness in care. The premise for this four-principled oath is based, in part, on the Hippocratic Oath, named after Hippocrates, the Greek physician of the 5th through 4th centuries BCE, who may have been the original author of the oath that outlines moral behavior and expectations of a physician. While the current bioethics or medical ethics principles just outlined are informed by ancient Greek medical ideals, it may be surprising to learn that they are in fact only recent formulations, as recent as the 1970s, by philosophers Beecham and Childress. It's also helpful to remember that ideas and concepts of medical ethics are not the sole domain of Western culture. Ancient Chinese and Indian, as well as medieval Ottoman cultures, all produced treatises and pledges related to preserving the integrity of the relationship between a caregiver and her patient. Deeply embedded within the principles of medical codes throughout the world and over time is the value of trustworthiness, and in particular, a trustworthy relationship between physician and patient, but also between medicine and society. One of the ways this trustworthy quality is coming into focus in recent years in the U.S. is through telling and listening to stories of patients, family members, and caregivers. Indeed, these testimonies can reveal that our code of medical ethics may not be universally applied, but may need to be inflected and nuanced, given a specific need based on prognosis or religious concern. Thus, this is how the layered and productive relationships of ethics, medicine, and narrative are at the heart of this year's examination of the four pillars of Western medical ethics. With an emphasis on narrative and testimony, the Mudd Center for Ethics program will offer a multidisciplinary inquiry from the fields of anthropology, art, ethics, law, medicine, and religion into poignant questions and dilemmas related to medical research, treatment, and access. As experiences of illness and health are integral to the human condition, we hope this program will offer points of engagement with these complex issues, and we welcome you to join us at any point during this year-long program.